150 years of service, innovation, and public health leadership. Evanston's health department has been at the forefront of keeping our community safe since its inception in 1874. Well, it all began in 1874 when the Evanston Board of Health was formed. This was 3 years prior to the establishment of the Illinois State Board of Health. This laid the foundation for a long history of health initiatives, starting with the department's response to the typhoid fever epidemic in the early 1900s. Between 1901 and 1912, the department identified polluted water as the cause of the typhoid outbreak, which affected close to 400 residents at the time. The health department's swift action saved lives and set the stage for modern water safety protocols. Then, from 1918 to 1920, during the Spanish flu pandemic, Evanston's health department implemented early versions of the strategies that we use today, encouraging social distancing and prohibiting public gatherings to slow the spread of the virus. Let's fast forward to 1947, when the department pushed for the introduction of fluoride into the city's water supply to combat dental decay. This was an initiative that greatly improved oral health for Evanston residents. In 1964, Evanston's health department not only served Evanston, but it expanded, forming the Evanston North Shore Health Department, serving nearby communities and growing the department's impact. Let's shift to 1987. The department became a leader in the AIDS awareness at the time, offering counseling and testing at a time when the epidemic was still misunderstood. Close to 400 residents were tested that year and received crucial support. By 2001, Evanston faced a new challenge with the West Nile virus. The department acted swiftly by implementing measures to test mosquitoes, birds, while educating the public. These protocols remain part of the department's disease prevention efforts today. And by 2002, there were 30 cases of West Nile virus in humans. In 2006, the department championed the city's first smoking ban in public places, leading the charge for the rest of Illinois. A few years later, in 2009 and 2010, the department responded to the H1N1 swine flu by establishing protocols through public awareness, education, including vaccinations. Close to 30 vaccination clinics were set up, and 12,000 plus Evanston community members were vaccinated against the virus. In 2012, the opening of the Erie Health Center ensured that essential medical services were accessible to all after budget cuts affected the department's own direct medical offerings at the time. Continuing its leadership in public health, in 2014, Evanston became the first city in Illinois to raise the tobacco purchase age to 21 to decrease tobacco usage among youth. That was ahead of the statewide law that was passed 5 years later. In 2014, Evanston Township was dissolved, resulting in the city assuming the duties and responsibilities of the township. Programs like general assistance and emergency assistance were absorbed in the health department. During the COVID-19 pandemic, the department took center stage once again, providing public education, situational awareness, weekly data reports, vaccines, contact tracing, and essential services to protect the most vulnerable community members. Recently, in 2023, the Evanston City Council approved the proposal to ban all flavored tobacco and menthol products with the support of the health department, making Evanston the first municipality in Illinois to enact a comprehensive ban. Now, in 2024, the department has begun using a new scientific method of qPCR technology to test and monitor the safety of beach water. This process expedites beach water results and help us to ensure that our community can enjoy safe and healthy summers. For 150 years, as you can see, the Evanston Health Department has stood strong, evolving, innovating, and always putting the health of our community first. Here's to the next 150 years of excellence in public health.